Hello, everyone. Welcome to our COPAR quiz. Today, we'll test your knowledge on community organizing participatory action research, a vital strategy for primary healthcare delivery in underserved communities. Let's dive in. Question 1. The COPAR staff is ideally composed of the following, except community organizer, training coordinator, student immersion coordinator, financial officer. The correct answer is financial officer. Rationale. The COPAR staff is ideally composed of a community organizer, training coordinator, student immersion coordinator, and health services coordinator. These roles are essential for community mobilization, capacity building, and integration of health services. A financial officer is not a standard component of the COPAR team, since financial functions are typically managed within the institutional support structure rather than within the organizing team directly engaged with the community. Question 2. Which among the following occurs in the pre-entry phase? Development of a criteria for selection of core group members. Development of a criteria for site selection. Development of a criteria for selection of CHWs. Development of management systems and procedures. The correct answer is development of a criteria for site selection. Rationale. The pre-entry phase involves preparatory activities such as area selection and assessment of community readiness. Developing criteria for site selection ensures that the chosen area is appropriate for COPAR implementation, focusing on communities with limited access to basic health services and high levels of poverty. This phase sets the foundation for effective entry and integration in the community. Question 3. The nurse is conducting a preliminary investigation on the different barangays for potential site of the program. The nurse knows that the following are to be considered for site selection: accept presence of similar agencies' programs in the community for better collaboration, health services in the community are inaccessible or inadequate for the residents. The area must have relative peace and order to ensure safety of the staff and students. Site must be socioeconomically depressed with majority below poverty line. The correct answer is presence of similar agencies' programs in the community for better collaboration. Rationale. The site should not have existing similar programs to prevent duplication of efforts and competition for community attention or resources. COPAR aims to empower unserved or underserved communities, so collaboration with similar agencies is not a criterion for site selection. Areas with inadequate health services, relative peace and order, and socioeconomic deprivation are prioritized to ensure need-based interventions and sustainability. Question 4. After integrating with the community residents and disseminating the information on the aims of the programs and primary healthcare activities, the community organizers plan to select the core group members who could actively participate in providing or validating data about the community and its people. The following criteria qualifies a person to be a member of the core group. Accept, must be willing to work for social change, must be willing to learn, and is open-minded, must be able to communicate oneself in a group, must belong to the upper sectors of the society. The correct answer is must belong to the upper sectors of the society. Rationale. Core group members should come from the poor and marginalized sectors to ensure that the process of community organizing truly represents the people's interests and realities. Members from upper socioeconomic classes may not fully reflect or prioritize the needs of the underprivileged, thus compromising equity and participation. Effective core group members are those willing to serve selflessly, open to learning, and capable of voicing community concerns. Question 5. Jonathan, a community health nurse, immerses himself to live in the community to assist the community members in identifying their problems. Participatory action research occurs in which phase of the COPAR process? Pre-entry phase, entry phase, diagnostic phase, community building phase. The correct answer is diagnostic phase. Rationale. Participatory action research, PAR, is conducted during the community study or diagnostic phase. In this phase, data are gathered and validated with community participation to identify problems, needs, and resources. PAR emphasizes the involvement of community members in analyzing their situation, ensuring that identified priorities reflect their perspectives and capacities for collective action. Thank you for joining this COPAR quiz. We hope this session has deepened your understanding of COPAR's principles and phases. Keep learning and advocating for community health.